Hi, welcome back to another episode of the Healthy Aging Network. I'm Kathy Tutt, and today we're going to be talking about the Ohio Senior Health Insurance Information Program, so please stay tuned. Today, we're going to be talking about the Ohio Senior Health Insurance Program. And I have joining me Kendra Burford, who is a community liaison with the Health Insurance Information Program. So Kendra, if you could please take just a minute here and introduce yourself and tell us about some of the things that you do.
Thank you, Kathy. Again, my name is Kendra Burford, and I'm a community liaison with the OSHIP program, which is the Ohio Senior Health Insurance Information Program. We are a federally funded program administered through the state of Ohio, and we help Ohioans understand Medicare. So we provide free, objective, unbiased Medicare information and counseling services through the Ohio Department of Insurance. We have a toll-free hotline. People can call for help during business hours at 1-800-686-1578. And then we also have a speakers bureau and volunteers across the state who can assist on a local level.
I feel like there's so much to know and so many questions that are asked. So I'm super excited to have you with us today. And I'm just going to let you take it away because I know you have a lot of stuff to share with us.
Here's just a little bit of an overview of OSHIP services. Again, we're a free, objective, unbiased educational resource for Ohioans. Here's our hotline number at 1-800-686-1578, which is operational business hours. And we can really help people do anything from comparing Medicare drug plans, comparing and enrolling in Medicare Advantage plans as well. We help a lot of people new to Medicare kind of understand the process and how to get started with Medicare. One service we started this time last year, and it's gotten fairly popular, is scheduling an online appointment with one of our counselors. So you can actually visit this website, Ohio medicarecounseling.as.me, and bring up our calendar and meet with one of us over the computer over Microsoft Teams, which has been a really nice addition to our services. And then we partner with local community groups, senior centers, medical centers to provide localized counseling services. And we have a volunteer training program as well so that people can assist locally in their communities. So we'll talk a little bit about Medicare today, and then we'll take some time for questions and answers. So what Medicare is, it's federal health insurance. And there are three groups of people that are eligible for Medicare. The group that people tend to think of are those 65 and older, but people can become Medicare eligible under age 65 due to being on Social Security disability or having end-stage renal disease, which is permanent kidney failure. Either way, you have two main ways to get your Medicare coverage. You can go with what's called option 1 or option 2. And when we're looking at open enrollment for Medicare, which starts on October 15th and runs through December 7th, it's really important for folks who are currently on Medicare to know which option they're on, because that's going to help us understand what you need to do during open enrollment to compare options so that you know what kind of products you're looking at. So option 1 is also called traditional or original Medicare, if you hear those terms. What it is you're getting Part A and Part B, so your hospital and your medical insurance through through the federal government. So Part A is your inpatient and Part B is your outpatient insurance. There are out-of-pocket costs with Part A and Part B. So some people look into adding a secondary insurance or supplemental coverage that pays after A and B at the doctor in the hospital. So that could be group health insurance through an employer or a union if they offer some sort of retirement package, can act as your secondary insurance to Medicare. Medicare Supplements or Med Sup plans are the most common way. Those are private insurance plans. You purchase them on your own from an agent, and they fill in the gaps or they supplement what Medicare doesn't cover. And then Medicaid can also act as a secondary insurance to Medicare. Either way, you have those two cards in your wallet. They work together and they form your healthcare coverage. You can round out your option 1 original Medicare coverage with a Medicare drug plan, or PDP, prescription drug plan. These are plans offered through insurance companies that contract with Medicare to offer prescription coverage. So this insurance would just work at the pharmacy. There's no medical component. And during Medicare open enrollment, you can look at Medicare Part D plans every single year, and they do change annually. So we recommend folks compare that Part D option every year during open enrollment, which again runs October 15th through December 7th. Option 2 is Medicare Advantage. And what these plans do is they take your hospital, health, and drug coverage all into one package. And you get that coverage through an insurance company that's contracting with Medicare to offer you a Medicare managed care product. So these plans are usually HMOs, health maintenance organizations, or PPOs, preferred provider organizations. So they do have a provider network that you need to use in order to be covered. With an HMO, you have to use that network. With a PPO, they prefer you use that network. And then they also have drug coverage involved as well. So they are truly a bundled care plan. And then these plans also have set their own out-of-pocket costs. So you may pay copays at the doctor, copays in the hospital, and so forth. So going into open enrollment, it's really important to know, am I on option 1 or am I on option 2? Because that'll let us know what you need to look at during open enrollment, because you do have lots and lots of choices. So when we look at Medicare, we have Part A and Part B. Again, Part A is our inpatient hospital coverage, short-skilled stays in a nursing facility, home health and hospice through Part A. Part B is our medical insurance. So really anything outpatient in the community is under Medicare Part B. So that includes outpatient services, doctor services, preventive services, durable medical equipment, and so forth. So Medicare was never intended to pay 100% of healthcare costs. So there are some out-of-pocket costs we'll look at briefly. That's why a lot of people look at secondary insurance to go ahead and fill in some of those gaps. And then another thing to know is that the buzzword with Medicare is medically necessary. So there are a few things that Medicare itself doesn't cover. The 2 big services not included in Medicare's core benefit are vision and dental services are not included. Anything related to eye diseases or disorders would be covered, but just a vision screening and glasses, as well as most dental work, is not included under Medicare. A lot of Medicare Advantage plans, so those managed care plans, may offer some vision and dental as part of their healthcare package. Always check with the plan to see exactly what's covered and how it works. One battery of services that Medicare covers are preventive services. So there are lots of preventive services included under Medicare. Most are free of charge, so there's no out-of-pocket for things like screening, colonoscopies, mammograms, and other tests and procedures. A couple that we'll highlight, one is the COVID-19 vaccine. Medicare does cover that in full, and they also cover the COVID-19 booster. So if you're needing the booster or eligible for the booster, Medicare is covering that. Take your red, white, and blue card to get that at the pharmacy. A few other ones they cover, flu shots are included free of charge once per flu season. And they cover welcome to Medicare physicals when you're new to Medicare, as well as an annual wellness check annually after that, which is just kind of a touch base with your provider to make sure everyone's on the same page. Medicare.gov has a lot of really good resources. So if you need a comprehensive list of the preventive services included, or really any other Medicare coverage information, Medicare.gov is a great resource. We encourage folks to check out Medicare.gov, create an account, because it can help you compare options later. And it's just a really great resource. So we have Part A and Part B. We have our hospital coverage. We have our medical coverage. There are some out-of-pocket costs involved with Part A and Part B. So that's where a lot of people look at secondary insurance. So they'll look at things like, again, group health insurance can pay secondary to Medicare. So that's coverage through an employer or a union. A lot of times those plans are the most comprehensive coverage available. So most of the time people go ahead and stick with those if they have that coverage available. Medicaid can act as a secondary insurance that's based on income and resources. So we always encourage folks to check with us at OSHIP or check with your local Jobs and Family Services office to see if you're eligible for Medicaid. And then the most common way to pay after Medicare are Medicare Supplements. So those are private insurance plans. You pick them up on your own from an agent, and they fill in the gaps in Medicare coverage. So they cover coinsurance and deductibles and out-of-pocket costs as you use your hospital and medical benefits. They go by a few different names. So if you hear Medigap, MedSup, or Medicare Supplement, those are all terms for the same thing. So some keys of Medigap plans. The first is there's no network of providers. So I can use any provider nationwide that accepts Medicare. So they're popular with people who travel, people who want to use any provider, who don't want to have to worry about that hospital network or doctor network, tend to gravitate towards Medicare Supplements. They only cover what Medicare covers. So these plans are only going to pay if Medicare is involved. So they don't have extras like vision, dental. Those are included in Medicare Advantage plans, not Medicare Supplements. However, if the benefit is covered by Medicare, usually there's little or nothing out of pocket for the patient because the MedSup is going to go ahead and fill in all or most of the remaining costs. So between Medicare and your Medigap plan, there's usually little or nothing out of pocket after you pay your premiums. So these plans can be pretty costly because you do have that kind of 100% coverage, but you're kind of paying up front to be covered in full. The nice thing about these plans is that they're standard. So there's 10 plans that are sold. They're named letters A through N. So I can purchase a Plan G, a Plan D, a Plan N that will work with Part A and Part B for what's left over at the doctor. And depending on when somebody was eligible for Medicare, there are a couple plans being phased out. So if I'm new to Medicare before January 1st of 2020, all 10 plans are available. If I'm new to Medicare after January 1st of 2020, plans C and F are no longer being sold. So again, if you have any questions on that, give us a call at OSHIP. We can also help you run some sample premium quotes. So OSHIP can't sign you up for a Medicare supplement, but we can help you compare options. We can show you what the plans cover. We can get you some sample pricing so that you can call an insurance agent and do the enrollment through them. So it just gets you kind of one step ahead before you call that insurance company. Now, these plans, since they're private, have their own enrollment window. So there's a one-time 6-month window when you're new to Medicare at 65 or older on Part B that they won't ask you health questions. Outside that 6-month window, I can try anytime I want. There's no annual open enrollment, but I can be subject to health questions. So I can shop around for a Medigap plan anytime I want. However, I probably am going to be asked health questions. They may look at, what previous health concerns I have. They may raise rates or even deny me coverage based on my health concerns. So again, when I'm new to Medicare at age 65 or older, that is the best time to look at a Medicare supplement if you're looking for one. And again, if you have any questions on that, give us a call at OSHIP. It does get pretty tricky. The last piece of our original Medicare puzzle is Medicare Part D. So this is the part we recommend people look at annually during open enrollment. So the way that Part D works is it's the drug coverage. And there's 2 ways to get it. If I am over here on option 1, I have Medicare with a supplement, I can get what's called a standalone drug plan or PDP. This just includes prescription coverage. Or if I'm looking at a Medicare Advantage plan, most of those include Part D as part of the healthcare package. So the rules are the same, the coverage is the same. It's just a matter of, is it by itself or is it bundled in my healthcare package? So I can look at Part D plans. October 15th through December 7th is Medicare's annual open enrollment. So we really encourage people to compare plans annually because the plans do sign 1-year contracts, which means from year to year, they can change. So the pricing can change, the drugs they cover can change. So we really recommend that people look at it annually to make sure their coverage is still the best it can be. There are a couple other windows when you could get Part D coverage. For instance, if I'm new to Medicare, the 3 months before, month of, and 3 months after my enrollment month, I can pick up Part D as well. So when I'm new to Medicare, I have a special window. And then I may have kind of a special enrollment period, like I move and my coverage doesn't cover me where I move to or something like that. I could pick up a plan at that point as well. But for the vast majority of Medicare folks, October 15th through December 7th is going to be your window to enroll in a plan or to change plans from year to year. And where we do that is on Medicare.gov. So Medicare.gov has a plan finder, and we put in medications, we put in the pharmacies that you want to shop around at, and it kind of shows us what the costs would be, which we'll talk more about here in a second. So for this year, there are 23 prescription drug plans available if I'm looking at only drugs. The way that we go through them is we say there's 3 C's to Part D: convenience, coverage, and cost. These plans all cover different drugs at different pharmacies at different prices. So we need to match those 3 things up. So convenience, all these plans have different networked pharmacies. Most of them also have preferred pharmacies where you get even better pricing if you use their preferred list. Most of them offer mail order, so we can also look at mail order pricing if that's something you want to look at. Coverage, which is basically what list of drugs does my plan cover. They all have a different formulary or a list of what they cover. So we want to make sure what you take is part of that drug plan. And then lastly, what's it going to cost? Because all these plans can price drugs differently. And the best place to do that is on Medicare.gov. So Medicare.gov's plan finder, we put in medications. We can put up to 5 pharmacies in. Most people put, 2 or 3. And then the plans that are the cheapest with what we put in kind of bubble to the top. So it makes it easy to see what would these plans cost based on the medicines that I take. We can even look at what would my current plan cost for next year versus some other options. So it makes it real easy to see if you're saving money by switching to a different plan. And again, OSHIP doesn't care which plan you go with. We just want to make sure that you understand what options are out there and that you're getting the best coverage for an affordable price. We can also help you enroll in the plan. So you can call us with your medication list. We can help you sort through the plans. If you want to do an enrollment over the phone, we're happy to do that. If you want to think about it, we can email you or send you the results and you can look at it and call us back to enroll if you want to. Here is a list of what the Medicare plans kind of cost for this year. So the way these plans work, the cost structure, is as I use my drug plan and get drugs filled, they keep a running tally of the total cost of my drugs. As that number increases, I jump into different coverage levels. So there are premiums for next year. They range from about $6 a month to about $99 a month. So there is a wide variety in premium. After that, after the premium, they're going to keep just that running tally of the total cost at the drugstore. So I could have a deductible of up to $480 for this year, or I'm sorry, for 2022. From there, I start paying co-pays or co-insurance. So that's when my plan's going to kick in and we cost share. So I'm going to play either a flat co-payment or 25% until my drug costs, total drug costs, reach about $10,700, $10,690. If my drug costs exceed that amount for the year, I'm in Medicare's catastrophic level, then they pay at 95%. I would pay the other 5%. So I know it's a lot of numbers. Medicare.gov will break it down for us. So it'll let us know when you meet your deductible, what each medication would cost. It adds it all up for us and tells us how it all works for you. Because all these plans do price drugs differently. So each plan has a different cost structure and formulary. Costs are annual. So again, they do change annually. For 2022, we've seen a lot of plans kind of merging and the premiums are going way up for some people. So we're really encouraging folks to give us a call or to make an appointment to compare options. And then these are also individual. So each person needs their own plan. What works for you may not work for somebody else. So even within a couple, a lot of times we have people on 2 different plans. Okay. There's some assistance out there to pay for Part D. It's called Extra Help. Again, if you have any questions on this, definitely give us a call at OSHIP. We can help you do the application over the phone. What it does is it helps with your costs at the pharmacy. So you pay little or no monthly premium, little or no deductible. You pay less per prescription at the pharmacy. Income and resource guidelines are right here, under $1,630 per month if I'm single, under $2,198 for a married couple, with liquid resources, bank accounts, under $14,790 for a single person, under $29,520 for a married couple. So again, if you have questions, give us a call. We're happy to talk people through it. The average savings is about $5,000 annually. So we definitely encourage folks to apply if they think they're eligible. The other way to get Medicare is Medicare Advantage. So these are the plans that combine your hospital, health, and drug coverage all together in one package. So these are for people who are enrolled in both Part A and Part B, and they're county specific. So all these plans have a different service area or county. So where you live is going to tell you what plans are available. One nice thing about these plans is that there's no age or medical restriction. So anybody who lives in the county on Part A and Part B is eligible. And also the premiums are a lot lower than Medicare Supplements. Some plans have no extra premium on top of Medicare. So again, these are the ones offered by private companies. So you're actually getting your Medicare through an insurance company. So there are two main types of plans here in Ohio are HMOs and PPOs, which means there's a network involved. So with an HMO, you have to use that network that's part of your plan. With the PPO, they prefer you use their network. There's an in-network and out-of-network rate. Most plans are going to include drug coverage. So you want to look at, are my drugs part of the plan? Are they affordable? What pharmacy do I want to look at? So again, just what we talked about with Part D, make sure that your drugs are also included in the Medicare Advantage plan. And then the big difference is the way the costs work with these plans. So when we talked about Medicare with a supplement, you paid that big monthly premium, but you were covered in full at any doctor. These plans work just the opposite. You're going to pay low or no extra premium on top of Part B, but you're going to pay copays and deductibles as you use your plan. So the more services you use, that's when you pay out of pocket. And that can vary from plan to plan as well, and from year to year. These plans do have an out-of-pocket maximum, so you do know what you're capped at if something would happen, but just be aware of what you would pay for a hospitalization or for a doctor visit or a therapy visit or something like that. So these are more of a pay-as-you-go. And these plans do have extras. So these are the plans that could include vision and dental, gym memberships, over-the-counter credits. There's lots of different extras that these plans offer. All the plans run them differently. So we always suggest checking with the plan to see how that coverage works. If I want to enroll in a Medicare Advantage plan, I can do it the same time other enrollments open. So when I'm new to Medicare, as well as fall open enrollment, October 15th through December 7th, we absolutely recommend checking your Medicare Advantage plan, doing the same comparison on Medicare.gov. And then if I'm in a plan in January, I have until the end of March to change to a different one or go back to original Medicare. So I kind of have a 90-day trial period with Medicare Advantage first of the year. And then we also just have a nice chart of the differences between the two. So a little bit of a recap. With Medicare and a supplement, you have a higher monthly premium after your standard Medicare premium. And then you pay little or nothing out of pocket, and I can use any provider nationwide. I do need a separate drug plan for these. So drugs would be separate. Medicare Advantage, I have little or no extra premium on top of Medicare Part B, but I'm charged copays and deductibles as I use my plan. And I have a network I need to stick to. So you do need to make sure that your doctors are part of that network. And again, these plans may have some extras like vision and dental. Make sure you know how that coverage is administered through your plan. So know your options. If you're on option 1 and you want to stay there, check your Medicare Part D plans every single year on Medicare.gov. If you're on option 2 and want to stay there, check those Medicare Advantage plans annually because they change from year to year. And then here is how to get a hold of us. So we encourage people in Ohio to call our toll-free helpline during business hours, 7:30 to 5, Monday through Friday. And we can help people with basic Medicare questions. We can help them compare and enroll in Part D and Medicare Advantage products. And we can also help them troubleshoot. So if they're in a plan and having problems, sometimes we can step in and assist. And then we also, if you want to email us, here's our general email box at oshipmail@insurance.ohio.gov. Somebody monitors that throughout the day. Insurance.ohio.gov is our website where we have lots of information. We have information about our webinars. So we do weekly and in some cases monthly webinars on different Medicare topics. So we encourage folks to attend those for more information. And then if you want to make an online appointment to talk to one of us, here's the link for that.
Wonderful. Kendra, thank you so much. I think, this is such a timely discussion that we're having because people really need to start looking at these things and reviewing them before that December 7th date and get their decisions made soon. So I really appreciate you talking about this. And we really hope that people will reach out to you so they can get all this stuff figured out and figure out the best plan for them.
Yep. We would love to assist.
Great. Thank you so much.
You're so welcome.